po ang Doctors on TV. Mga kasambahay, ang topic natin sa umagang ito, human papilloma virus infections and cervical cancer. Kasama pa rin natin ang host ng Women's Health, Dr. Steph Supan. Morning, Doktora.
Earlier we were talking about yung transmission ng warts, no? Meron dyan na towel, kaya nga nauso daw, sabi ni Doktora, yung paper towel. No? Doktora, ano naman ang klaseng HPV na nakakakos talaga ng cervical cancer sa mga babae?
Okay, ang high risk talaga are HPV 16 and 18. Sila yung very much associated with cervical cancer. Pag yung dalawang yon ang nag-positive ka, talagang kailangan very vigilant ka no, sa pag-screen, pag-monitor.
How
no?
will you know if you have it?
Oo. Yun nga, there is a test called HPV DNA test. I-identify din naman niya kung ano yung mga subtypes na meron ka. So alam mo kung mga benign lang siya, yung mga low risk lang, or nandun ka sa high risk. And once you're diagnosed of that, monitoring lang talaga. Parang may certain period, no, every 6 months, yearly, na magpapa-HPV DNA test ka. Tsaka, syempre, pap smear is very important.
Sa swab nakikita yung HPV.
Yes.
HPV 16 and 18.
Yun yung high risk.
High risk.
Oo.
Question, Doktora, yung mga tumutubo sa mga leeg-leeg natin, sa mga face natin, may chance ba ito na HPV 16 or 18 na ito?
No, very, very low. No? Kasi iba yung mga subtypes na nagkakos ng genital wart sa other parts.
And sa
no?
Philippines, marami talagang may human papilloma virus infection.
Madami all over the world actually, no? Pero in the Philippines, kumbaga sa Amerika, ang pinakamadami nila is mga endometrial, no? At saka ovarian cancer. Sa atin, cervical talaga.
Cervical
Actually,
cancer.
in most third world
Ilan ba ang cervical
countries.
cancer sa atin?
Hindi, sa mga reproductive organs, siya yung number one, no?
Okay.
Cervical. Pero yun na nga, it's very unfortunate kasi there is a screening test, no? Which is pap smear nga. Kasi ang purpose ng pap smear is to catch it early. Kasi halimbawa, na-diagnose ka may HPV. Yun na nga, no? 90% pwedeng mag-resolve, pwedeng mawala. Pero yung other 10%, yun yung pwedeng mag-progress. Tapos, hindi naman siya biglang, after 1 month, cancer ka agad. Hindi naman siya ganoon. Meron siyang mahaba, no? Yung timeline. Yes. So, there is a lot of time, no? Para makatch mo siya early. Kasi, pag nagka-HPV ka, hindi naman kaagad cervical cancer, no? Merong mga tinatawag na cervical intraepithelial neoplasia or parang mga precancerous.
Mga stages pa.
Yes.
Before it becomes full-blown cancer.
So pag na-catch mo siya na precancerous, it's very much treatable. Pwedeng operahan, pwedeng tanggalin.
I-clarify ko rin, Dr. Saan ba talaga yung cervix ng babae?
Oo, ang cervix ng babae, halimbawa ito yung matres, no, o bahay bata. Yung cervix, yun yung parang leeg niya. No,
Okay.
bago
Okay.
the
Sa bottom.
vagina or yung puerta. So yun yung in between the matres and the
Parang
vagina.
yung opening into the uterus na.
Yes.
So, parang
oo.
tinatawag nila na parang kwelyo.
Kwelyo ng matres.
Kwelyo ng
Oo.
matres. So, and that one, when it becomes cancerous, magkakaroon ng tumor growth dun sa kwelyo ng
Oo.
matres.
So initially, pwedeng maganda pa yung cervix, no? Minsan lang may konting gasgas lang, minsan lang may parang konting dugo. Kaya very important yung pap smear kasi yun yung tinitignan namin. So minsan wala kang symptoms, no? Wala namang discharge, walang bleeding. Usually late na no? Pagka late stages ng cervical cancer, yung may amoy na yung discharge, meron ka ng bleeding, pero very early on, wala siyang symptoms. So, when we do pap smear, nakikita namin yon and we're able to recommend na kailangan kang i-biopsy, kailangan gawa ng ibang test.
Sino ba dapat ang magpa-pap smear and how often kaya ito?
And how young ka
How
dapat
young,
mag-start?
Oo. Ang pap smear is done by the gynecologist. You can start as early as 18 years old or as early as your first sexual contact.
Okay, that early, ha?
Yes. And then, pagka as a routine examination, it should be done once a year. Okay? Unless meron ngang minomonitor, sometimes you have to do it more often. Tapos, mabilis lang ang pap smear, no? Yun na nga, hihiga ka, tapos sisilipin lang siya, take a swab, and then tapos na. As in less than 1 minute.
Sometimes ginagawa sa health centers pa nga yan.
Health centers lang.
Maraming ang siguro maling misconception ng mga kasambahay natin. Dok, yung iba kasi natatakot. Kasi kung masakit ba siya or
Well, number one, of course it's a little uncomfortable, no, for any woman because you'll be undressed, no, it's an awkward position. Pero if it's done with the proper technique, it shouldn't be painful. Yun ang lagi kong sinasabi sa mga pasyente. That's why we take your history. Single ka ba? Nanganak ka ba? Ilan na yung anak mo? Normal delivery ka ba? Cesarean? All these informations will help us na kung paano
Figure out.
gagawin yung pap smear to use the appropriate instruments kasi hindi siya dapat masakit. No? Sabi ko nga, pag masakit yung pap smear, magpalit ka na ng gynecologist.
Ganun pala yun, ha?
I like that. Talking about pains, no? Doktora, yung may mga painful na mga contacts, no? Sexual contact. Ito ba ay preliminary or ito ba yung mga symptom na rin ng mga cervical cancer?
Very rarely, no? Kasi usually, mga problems yan with lubrication, position. Pero kahit may cervical cancer or early stages of cancer, sometimes there's no pain.
And if you do get diagnosed with cervical cancer, is prognosis good?
Siyempre, the earlier the stage, the better the prognosis. So, kaya nga, kung pre-cancerous, that's even better. Yun talaga, pwedeng completely treatable siya. Pero pag na-diagnose na, siyempre yung mga stage 1, yan, pwedeng operahan. Pag mga stage 3 pataas, chemotherapy, radiation therapy, marami namang choices. Pero the earlier, the more treatable it is.
Question, if ever you have the cervical cancer, no, what are the effects sa isang babae kung meron kang ganun? Hindi ka na ba, mahirapan ka na ba manganak? Or would you have problems with, yun nga, conception of the baby?
So, depende din yan nga sa stage. If it's precancerous or early stage 1, pwede ka pang operahan na yung cervix lang ang tatanggalin. Okay? So, pag yung cervix lang yung tatanggalin, you still have your uterus. Pwede ka pang magbuntis. But if it's beyond stage 1, definitely, mahirapan na talagang mag-pregnant. No? So, the pagkabata pa yung nagkaroon ng cervical cancer, magkakaroon talaga siya ng malaking impact sa fertility, no? Pwedeng hindi na magkaanak. Kasi naman pag nag-radiation or chemotherapy, yung ovaries mo naman yung mauubos yung eggs kahit nandyan pa yung matres.
Just like any other cancer, early detection is very important. And this we can do through pap smear. But I guess it's also
Yes.
important if we can prevent it altogether.
Oo, yun yung dapat i-emphasize natin, ano? Kasi of all the cancers, cervical cancer pa lang ang may potential for prevention dahil nga meron ng
Vaccine.
HPV vaccine. Ang HPV vaccine, very simple lang naman siya, no? Actually, wala siyang preparation. You just have to go to your doctor's clinic, have the injection. You can give it as early as 9 years old.
9 years
How
old.
often do you
Yes.
need to have it?
Ang usual dose ng HPV vaccine, 3. No? May schedule yan. Kunyari, the first dose is given today, the next one is after 1 to 2 months, and then the last one is after 5 to 6 months. So, 3 doses lang siya.
What if you miss, kunwari, nagpa-vaccinate ka, kasi ako,
Once, for example.
once pa lang eh. Nagpa-vaccinate ako once pero hindi ko na po na-follow up. Should I go back to step 1 na?
If it's within
Ulit?
a year, pwede mo pa siyang i-continue.
Okay.
Pero pag nag-lapse na yung 1 year, start from the start
Start
ka
from
again.
the beginning.
Yes.